Does the administration have a harder sell now because of the problems with Healthcare.gov and trying to persuade young people to come back to and try and consider health insurance?
Well, I think there's one interesting piece of news, which is there's an estimate of about 5 to 7 million young adults who actually can go online and buy a bronze plan and have actually no premium at all. So it's actually less than the cost of paying the individual mandate penalty. Now, I'd rather those folks go silver or gold or something better and not expose themselves, but still, that's a pretty attractive offer if the word on that gets out to people that you can go on, get coverage for nothing, and avoid paying the penalty.
So that's the short-term, long-term issue. So Gallup's been surveying uninsured young people. At least a third of them say absolutely they're not going to do this. What was amazing in today's release is that Republican young people are much more likely not to want to buy the insurance. They're making a political statement for it. But most people didn't know there was a website. They didn't even know how to enroll. So this is a long-term issue. You can get these people enrolled if you do this. But in the short term, they are not going to be revving in with their motorbikes to do this. You don't sell products to people who aren't aware they exist. That just generally is where we are today. But a year or 2 years from now, of course, you can go get them. But if we're making November this big decision-making point, a lot of young people are not going to be there who are not clearly aware of what John was talking about.
We were talking about possible horror scenarios, and one of the ones we discussed is what happens if someone tries to get the coverage or thinks they have it and they don't have it, and so on. And then Kate was rightly saying that has implications for the premiums and so on. Just to play out what Kate said 1 minute, because it's very important. If you look at the prices in the exchanges, as John said, they're much cheaper than people thought. And there was a study that McKinsey did very recently that showed that the reason why they were cheaper is because new insurers entered, and it's those new insurers who are coming in at very low price points for people. The difficulty is that those insurers are not outside of the exchanges. They've been created by the Affordable Care Act, and they're inside the exchanges. So if you can't get them a good mix of folks, they're not well capitalized, so they may go under. And so you may lose the sort of low price segment of the insurance exchange. The big insurers will be fine, because if whatever they don't sell on the exchange, they'll sell to people off the exchange, and the whole thing will work out just fine. But I worry that there's some danger to the kind of most innovative segment and the cheapest segment of the insurance industry, and that could be problematic if it turns out that way.